Imagine that you're at home watching a football game with your dad. Suddenly, he doubles over in pain and falls to the floor. After a few seconds, he passes out. You're freaked out and scared, but do you know what to do? Do you know how to save his life? Hi, my name is Josh McBride, and in this series, we'll briefly go over some important first aid basics. Helping me out will be Chris Mills, a registered paramedic and firefighter from the Boston area. So Chris, you've had 20 years of experience as a paramedic. Is first aid the kind of thing that takes a lot of training to get good at?
To become a paramedic takes a lot of training, but to help in an emergency only takes calm nerves, some common sense, and a few simple techniques that I can show you.
We'll be covering all kinds of medical scenarios, from choking to heart attacks, burns to seizures, diabetic emergencies to allergic reactions. But before we go into detail about specific scenarios, Chris, what are some general rules that almost always apply?
The first thing to do before anything else is call 911. Get help on its way before you try to help someone yourself.
What if you're not sure if the situation is severe enough to call 911?
Call anyway. You can always call back to cancel. If the ambulance arrives and it turns out to be something minor, we won't care. Also, your first priority is your own safety. For instance, if somebody is drowning, don't swim out to save them. Or, if someone has been injured out on a busy highway, don't rush out there unless you're sure the situation is safe.
With that in mind, let's get started. Did you know that heart attacks are the most common form of sudden death? There are more than 1 million heart attacks in the United States each year, and many of these people die. Many more could be saved if people around them knew what to do. So Chris, what exactly is a heart attack?
A heart attack is when one or more of the blood vessels supplying the blood to the heart muscle become blocked. If the blockage is bad enough,
The person's heart may stop beating.
and when this happens, no blood gets to the brain. A heart attack victim only has about 5 minutes before brain damage sets in. Your job is to call for help and keep the blood flowing.
We've all seen heart attacks portrayed on TV, but how do you know when someone's having a heart attack?
There are a number of different signs and symptoms. Most commonly, a person will feel discomfort or pain in the center of their chest. The pain may stay, or sometimes it goes away and comes back again. It might feel like an uncomfortable pressure, squeezing, or fullness. At the extreme end, some people say that it feels like an elephant is sitting on their chest.
So if someone clenches their chest, we'll know that he or she is having a heart attack?
Yes, but the pain or discomfort isn't always in their chest. Sometimes it's in one or both of their arms, or their back, neck, jaw, or stomach. Sometimes they don't feel pain at all. Instead, they get suddenly short of breath, or they may break out into a cold sweat or become nauseous or lightheaded.
Wow, there are just so many symptoms. It's getting pretty confusing.
That's right, and remember, time is of the essence. Call 911 immediately.
Next, we'll show you how to perform chest compressions. So here's what to do if someone's heart stops beating. We've asked our good friend Colin Gillis to volunteer.
Hi, Josh.
Hi,
Good
Colin.
seeing you again.
You too.
Wow, not bad.
Thanks.
Okay, the first thing you want to do after calling 911 is to check to see if the victim is breathing. Just put your ear to their mouth and listen for a breath, like this.
So what do you do if they're not breathing?
If they're not breathing, check to see if they have a pulse. This will tell you whether or not their heart is beating. Place 2 fingers on their carotid artery, like this. They're on both sides of a person's neck. Check to see if you feel a slight pulse about every second or less.
And if you don't feel a pulse?
If you don't feel a pulse, their heart has most likely stopped beating. You need to start CPR right away.
So I've seen CPR demonstrated before, and it's kind of confusing, and the rules keep changing. Plus, mouth-to-mouth is kind of gross.
Actually, CPR has gotten much simpler, and you don't even have to do mouth-to-mouth anymore. Just chest compressions. CPR is really important because if you do it right, you can increase a victim's chance of survival by 20 to 30%, because the chest compressions keep the blood circulating.
Okay, so what do I have to do?
The first thing to do is figure out where to place your hands. Start by finding the bottom of the victim's rib cage, then follow all the way up. At the top of the rib cage, there's a small dip called the xiphoid process.
Don't worry about the name, it's just the depression in the center of your chest just below your nipples. Take your 2 fingers and put them over the spot, just like this. Then place your palm right above that. This is where you're going to push down. Interlock your hands like this with your bottom palm right over this spot. Now just push down approximately 1 to 2 inches and let up. Do this 100 times a minute, like this. 1 and 2 and 3 and 4 and 1 and 2 and 3 and 4.
Chris, how long do I do this for?
You just keep going until help arrives. After a few minutes, you may get tired. If you do, ask someone else to jump in and take over.
Now, there is one other very important item to think about in case someone's having a heart attack. Most schools, malls, airports, and other public places will have an automated defibrillator somewhere nearby. If there is someone there to assist you, send them off to find a defibrillator as fast as they can. Automated defibrillators are easy to use, even if you've never seen one before. Just open the case and it's going to start talking to you.
Connect electrodes.
It will tell you to take off the patient's shirt and put the pads on the victim's body. It will show you exactly where to put the pads.
Check connector and electrodes.
Once the pads are placed on the victim, the defibrillator's computer will then analyze the patient's heart to see if it's in a shockable heart rhythm. An alarm will then sound and the machine will send a jolt of electricity into the victim's heart. After the shock has been administered, the machine will tell you to check for a pulse. If there is still no pulse, it will tell you to start chest compressions again until it's ready to administer a second shock. The defibrillator is effective, but if you're alone, don't go off to look for one. Just call 911 and perform CPR.
So to sum up, if someone's having chest pain or other heart attack symptoms, call 911 immediately. If the victim has collapsed or you find them unconscious, check for a pulse.
If they don't have a pulse, call 911 and send someone to search for a defibrillator. In the meantime, start chest compressions and continue until help arrives.
After heart attack, the next most common cause of sudden death is stroke. In fact, strokes and heart attacks are closely related. A stroke is like a heart attack, except instead of blood supply being cut off to the heart, it's cut off to the brain. Strokes are caused by a blood vessel in the brain that becomes blocked or rupture. Then that part of the brain begins to die. So Chris, who gets strokes? Just old people, right?
Wrong. They're most common in older people, but they can happen to anyone.
Like heart attacks, strokes can present themselves in many different ways. Oftentimes, someone will suddenly develop numbness or weakness in their face, arm, or leg, usually only on one side of their body.
That's because the brain is split into 2 halves. The weird thing is that when the stroke occurs on the left side, the symptoms pop up on the right side, and vice versa. The wires are crossed.
Other common symptoms are confusion, trouble speaking, or trouble understanding. Someone might also start having trouble seeing out of one or both of their eyes. They might have trouble walking, dizziness, or loss of balance, or coordination. And finally, they might develop a severe headache with no known cause.
If you see someone with any of these symptoms, it is very important to call 911 right away and tell them you think somebody may be having a stroke. Right here, sir. Have a seat. After you call 911, sit the victim down and talk with them. By talking, they keep their airway open so they're able to breathe. You definitely don't want them to stop breathing before the ambulance gets there. Sir, the ambulance is on the way. Help is coming.
Oh, thank you.
And here's another important tip. Write down the time that the symptoms first appeared.
Why is that?
If a victim can get to the hospital within 4.5 hours after the first symptoms appear, doctors can give them a drug that breaks up the blockage in their brain and allows blood to flow again. But the doctors need to know exactly when the stroke began.
That's good to know.
I've heard the symptoms of a stroke can be subtle. What if I'm not sure whether someone's having a stroke or not?
It's important to call 911 even if you're not sure. If the ambulance gets there and the person doesn't want to go, fine. It's a lot easier to send the ambulance away rather than wait until it's too late and then call.
Strokes are something you need to take seriously. With fast action, a lot of damage can be avoided. So if you think someone might be having a stroke, call 911 immediately. Okay, so you're out in the woods hiking, and your friend falls hard and cuts himself on a big piece of glass. Or maybe suddenly their arm or leg is at an angle it was never meant to be at. What should you do?
As a rescuer, one of your most important jobs is to first keep yourself safe. Stay out of dangerous situations and don't expose yourself to blood or other bodily fluids. If it's only a small or moderate cut and you think the bleeding will stop within a few minutes, just have the person put pressure on the wound. The bleeding should stop on its own.
If you think the cut is a little more serious but not enough to need an ambulance, take the person to the emergency room yourself to see if they need stitches.
Just make sure you don't get any blood on yourself. Blood can transmit all sorts of nasty diseases, such as hepatitis and AIDS. The person may not even know that they have these diseases.
Chris, that sounds kind of dangerous. How do you prevent that from happening?
The best way to protect yourself is to put on some rubber gloves. You should carry a pair with you. They're cheap.
Now, what do you do if you get blood on yourself?
Wash it off with soap and water as soon as you can, and tell a medical professional.
If there aren't any rubber gloves around and the patient is conscious, get some paper towels or a cloth towel and ask them to put direct pressure on their own wound. They can't contaminate themselves.
Now, if the cut is bleeding a lot, so much that you can't stop the bleeding, or if they're losing a lot of blood, call 911 immediately. Put pressure on the wound and try and raise it above their heart.
Chris, I've seen in the movies how they put a tourniquet on someone's leg or arm. How do they do that?
That's really dangerous. If you cut off the blood to a person's arm or leg, there's a good chance they could lose it forever. Don't use a tourniquet unless you really think the person is going to bleed to death. It's better than dying, but don't do it without very good reason. If you must use a tourniquet, loosen it every few minutes to give the limb some blood.
Now, severe cuts often mean lots of blood. Unless they're really bad, they're not usually life-threatening. Just try to stop the bleeding by putting pressure on the wound, and take the victim to an emergency room. Chris, what if the victim has a broken bone?
There's not much you can do in this situation. The best thing to do is keep the patient still and call 911.
The more the victim moves, the more likely they are to damage themselves further. The sharp edges of the broken bone can cut into the muscles, tendons, joints, and even arteries.
When you move the victim, the risk of serious injury increases tenfold. And if you think the victim may have damaged their back and neck, it's especially important not to move them at all. By moving them, they can become permanently paralyzed.
Sometimes the bone may be sticking out.
This is called an open fracture. If you come across an open fracture, treat it like a cut or an open wound. Apply direct pressure to the wound and raise the limb to slow the bleeding.
But I thought you're not supposed to move a broken bone.
That's right, so just move it a little bit and very carefully so you don't do any more damage.
Remember, in all of these scenarios, do your best to keep the patient calm and still until help arrives. That's the best way you can help, without doing more harm than good. Some of the scariest injuries are burns. Often the person is in a great deal of pain and there may still be a lot of smoke and flames around. There might even still be a fire.
Before you do anything, make sure you're not in any danger. Look around you. Don't run into burning buildings. It's not like in the movies. Take the victim away from the smoke and the flames and find a safe place to sit.
There are 4 different categories of burns. First-degree burns are just minor burns, like a sunburn.
These can be painful. The skin may turn red and become swollen. Usually they will just get better on their own.
In second-degree burns, the skin may begin to blister and possibly ooze.
They tend to be very painful. In this case, you should definitely take the victim to an emergency room.
Now, third-degree burns are bad. The skin turns black and becomes charred, and some of the skin may be burned off.
Surprisingly, this kind of burn may not be as painful as a first or second-degree burn. This is because all the nerves have been destroyed. In this situation, call 911 immediately.
Finally, fourth-degree burns are when the burning is so bad that much of the skin and flesh has been burned away, and the bone is showing through.
I don't have to tell you to call 911. If you see one of these burns, you'll already be on the phone.
What can you do for someone who was burned? Would cold water help?
No, don't put anything on the burn, not even cold water. This could lead to an infection.
What should you do if the person's still on fire?
This is the one situation where you shouldn't call 911 first. Instead, the first thing you should do is put the fire out. Tell the person to drop on the ground and roll around while covering their eyes and face. This should smother the fire.
I think a lot of people panic when they're on fire. What do you do if they start running?
Running just makes the fire worse by fanning the flames. Try to catch them and throw a coat or a blanket over them. Force them onto the ground. Once they're on the ground, then you can help smother the fire.
Should you pour water on the fire in this case?
No, don't pour water on the fire, just pat it down. If the fire is only on a small area like their arm, you can just put it out with your hands. Once it's out, you can check for burns. After that, call 911.
To summarize, if a person has a first or second degree burn, just take them to the emergency room yourself. If it's a third or fourth degree burn, call 911. If the person is still on fire, smother the fire with a blanket or coat, or tell them to drop and roll. Then call 911. Whatever you do, don't try to be a hero and put yourself in danger. Your first priority should be your own safety. Diabetes is on the rise in the United States. There are now more cases than ever before. Chances are, you might know someone with diabetes. People with diabetes don't produce enough insulin, which is a natural hormone. Without enough insulin, they build up dangerous levels of sugar in their blood.
But sometimes they accumulate too much insulin. Their blood sugar drops too low, and they go into what we call a diabetic emergency. This can be very dangerous.
Here are some of the symptoms: acting or talking irrationally, not making any sense, sweating more than usual, breathing becomes short and shallow, headache, trembling, unusually strong thirst, and nausea.
If someone is having these symptoms, first check to see if they're a diabetic. An easy way to tell is to look to see if they're wearing a silver or gold bracelet with a circle on it. If the person is still conscious, give them a piece of candy or a drink of juice. This will raise their blood sugar level. But if they're unconscious, don't put anything in their mouth and call 911 immediately. While you're waiting for an ambulance, have the person lie down on their side and rest quietly. That's it. Few people die from a diabetic emergency as long as they get help quickly.
Have you ever been somewhere, maybe in school or on a sports field, when someone you know fell onto the ground and started shaking uncontrollably? They were probably having a seizure. Seizures are very common. 1 in 10 Americans will experience at least one sometime during their lifetime. So it's important to know what to do when someone has a seizure. Chris, what exactly is a seizure?
A seizure is when the electrical system of the brain malfunctions, which causes brain cells to fire uncontrollably. This causes unconscious and uncontrollable rapid muscle contractions. Seizures aren't usually life-threatening, and they only last a couple of minutes. But they can be dangerous if they happen while someone is driving a car or swimming, for instance.
The symptoms include the following: uncontrollable shaking of the arms and legs, eyes rolling in the back of a person's head, temporary confusion, and loss of consciousness or awareness.
Some people think that people swallow their tongues while they're having a seizure. This isn't true. Don't put anything into their mouth. They could choke on it. But it is important to keep their airway open for breathing, which can be done by laying them on the ground on their side. Also, it's important to keep the person away from anything sharp or hot.
Should you call 911?
Not necessarily. Some people have frequent seizures, and it's not necessary to call an ambulance every time. When they come out of their seizure, they'll probably know what to do. But if the seizure lasts longer than 5 minutes, without signs of slowing down, or if the person has trouble breathing during or afterwards, call 911 right away. Also, call 911 if a person has another seizure soon after the first one, or if the person has a health condition like diabetes or is pregnant.
After the seizure, the patient might fall asleep. That's called the post-epileptic stage of seizure. This is the body's way of protecting itself after all that activity.
Don't panic, but if you can't wake the person right away, call 911.
Seizures are common and not usually life-threatening. The best thing to do is keep the person safe and wait till they stop shaking. We've all probably experienced a classmate or friend breaking out in hives after eating something they're allergic to. This is what's called an allergic reaction. These are very common. Most of them are mild, but sometimes they can be life-threatening. You want to take them seriously. They can be caused by many things: bee stings, medications, various foods like shellfish or peanut butter, and even materials like latex gloves. Typical symptoms are itchy skin, a strange sense of warmth or impending doom, a swelling throat, an enlarged tongue, wheezing, or trouble breathing.
When someone starts having any of these symptoms, call 911 immediately. Within a few minutes, their throat may become completely swollen and they may stop breathing. If the person knows they're allergic to something, they may carry an EpiPen. This is a needle containing a drug called epinephrine. The person can usually give it to themselves. They just jab it straight through their pants leg and into the muscle. The EpiPen will slow the swelling until help can get there.
Now what if the person's not having an allergic reaction?
It's not a problem. The EpiPen may make their heart race a bit, but it's not likely to hurt them. If you have to stick someone with an EpiPen, it's easy. Just flip the cap open and pull the EpiPen out. There's a colored safety on the top of the EpiPen. Remove the cap and press the EpiPen up against their leg. Push down and hold it for 10 seconds. Then pull out the EpiPen and place it in a safe place. The only time you do not want to use an EpiPen is when the person is unconscious. In this case, call 911 and give CPR if they stop breathing.
An asthma attack is similar to an allergic reaction. It's caused by a combination of environmental and genetic factors. These are some of the symptoms: irregular coughing, wheezing, or trouble breathing. Asthma attacks can be triggered by physical activity, cold air pollution, and even stress.
Many people with asthma carry around inhalers. The medicine in the inhaler helps relax their airway and lets them breathe easier.
So what do you do if someone's having an asthma attack?
The most important thing to do is remain calm and call 911. Ask the person if they have their inhaler. If they nod, help them look for it and put it in their hand. If they don't have an inhaler, just remain calm and call 911.
Even if the patient has an inhaler and uses it, it may still be a good idea to call 911. If he or she still seems to have trouble breathing, you can always call back to cancel the ambulance, but you can't fast forward time when someone's deep into their asthma attack. An asthma attack can be a dangerous situation. Take it seriously, and don't hesitate to call 911 if you think it's serious. Choking is another common medical emergency that can happen suddenly. A person may be happily eating a piece of candy one minute, and all of a sudden they're gasping for air. When this happens, it's important to administer first aid as quickly and as calmly as possible. Most people tend to clutch their throats and turn slightly purple when they're choking. What are some of the other symptoms we can look for?
Often, the symptoms aren't as obvious as you might think. Let's say you're eating at a friend's house and you begin choking on a French fry. You don't want to embarrass yourself, so you try and hide the symptoms.
So then how do they know you're choking?
There are some things you just can't hide. When you're choking, it's hard to talk, and your breathing gets noisy. It's difficult to cough, and your skin, lips, and nails might turn blue. Finally, if someone still hasn't noticed that you're choking, you might lose consciousness and fall over.
I hope I make it obvious if I ever start choking. So what should you do?
The first thing to do is stand behind the person and deliver 5 back blows between the person's shoulder blades, like this with the heel of your hand. If that doesn't work, you'll need to do the Heimlich maneuver.
The Heimlich maneuver, I've heard of that, but I have no idea how to do it.
Okay, first wrap your arms around the person's waist and tip the person slightly forward. Make a fist with one hand and put it slightly over the person's navel. Then grasp the fist with your other hand and press hard into the abdomen with a quick upward thrust. Do it as if you were trying to lift someone up. The best thing to do is alternate between 5 blows and 5 Heimlich maneuvers. Just keep going.
If there is someone else there with you, tell them to call 911 right away, while you continue with the back blows and maneuvers.
If you're the only other person with a choking victim, call 911, then go back to back blows and Heimlich maneuvers. If the person passes out, call 911 right away. Then you want to begin stomach thrusts.
Stomach thrusts?
Get down on the floor next to the patient and take your palm and thrust it inward and upward into their stomach. Just like this, only harder. Hopefully, by doing this, you'll be forcing air out of their lungs and it will dislodge the item that they're choking on.
Here's another scenario. What if you're alone and you choke on something?
You can do a modified version of the Heimlich maneuver on yourself. Find a chair and place your fist right above your navel. Grasp your fist with your other hand and sort of fall onto the back of the chair, like this.
Does that really work?
Yes, it works. I had to do it on myself once, and I'm still here, aren't I?
I guess, but what if an infant's choking?
That's a little different. They're fragile and you might hurt them. If you're dealing with a choking infant, it's best to call 911 unless you've been trained and know how to deal with that situation.
Remember, if someone starts to choke, deliver 5 back blows, and if that doesn't work, use the Heimlich maneuver.
If that doesn't work on the first try, call 911 and keep alternating both techniques until the object comes out or an ambulance arrives.
During a hot day in August of 2010, 6 teenagers were found dead after swimming in the Red River in Shreveport, Louisiana. The cause? They were all trying to save their one friend who was drowning after he slipped into the deep water. As soon as the first teen got into trouble, the others instinctively rushed to help and got themselves into trouble. This happens all the time. Every year, 3,000 to 4,000 people die from drowning in the United States. And often, it's more than one at a time. By knowing what to do and remaining calm, you could help prevent an unnecessary death and keep yourself from getting into trouble too. There is one steadfast rule that we can learn from the Louisiana drownings. Unless you're a certified lifeguard, don't try to swim out and save someone.
That's right. Swimming out to save a drowning person is a very dangerous idea. Instead, throw them something that will float or something you can use to pull them in, like a tree branch or a rope.
When people are drowning, they can panic and become very strong. They may try to climb on top of you and push you under. That's why it's important to throw something instead of swimming out to them. Chris, what if you can't find a stick or rope and need to go get help?
Tell the person you're going for help, and when you get to shore, call 911 right away. Also, put a marker, a branch, stone, or anything on the ground on the shore directly in front of where you last saw the person drowning. That way, when help gets there, they have an idea of where to start looking.
To sum up, if someone's drowning, don't swim out to save them. Instead, find something that floats and throw that to them. If you have to run for help, put a marker on the beach so that the rescuers know where to start looking. According to the Centers for Disease Control, an estimated 1.7 million people sustain a head injury each year. It's a lot of people. Whether it's a small bump, a blood-gushing gash, or a concussion, head injuries are serious medical emergencies. And often, well-meaning rescuers can make the situation worse, resulting in an additional head, neck, or spinal cord injury if you don't know what to do.
The main thing to remember when you're dealing with head injuries is to keep the patient still and to keep that person and yourself out of harm's way. Don't try to move them. If you do, you might damage their spinal cord or sever an artery in their neck. If it's a bad head injury, you'll know it when you see it, but less severe head injuries can be hard to spot.
Bad head injuries often have obvious symptoms. You'll notice bleeding from the head or face, bleeding from the nose or ears, a severe headache, black and blue discoloration, or vomiting after being hit in the head. But Chris, what are some of the less obvious signs of a head injury?
Some of the less obvious symptoms might include changes in the level of consciousness for more than a few seconds, if the victim stops breathing, if the person looks like they're losing their balance, unequal pupil size, slurred speech, or even a seizure.
If you see any of these symptoms, it's important that you call 911 right away. Keep the victim still and reassure them that help is on the way. Chris, what do you do if the person's bleeding badly?
If you have rubber gloves, put them on. Again, we want to make sure that you're safe and that you avoid possible disease transmission. If you don't think it will do more damage, apply pressure to the wound to stop it from bleeding. If you don't have gloves, take some cloth and apply it over the person's wound. Ask them to hold it there if they can.
What if someone gets into a serious car accident and suffers a severe head injury?
Keep the victim still and keep yourself and them out of harm's way. Don't try to get them out of the car if you don't have to. Try to direct traffic around the scene or get others to help you. If you don't feel that the scene is safe, do not approach the patient. Call 911 and wait for help to arrive.
To sum up, call 911 for any potentially serious head injury. Then determine whether you and the victim are safe before proceeding with first aid. Don't move the person. If there's blood, try to avoid coming into contact with it, but put pressure on the wound. If the person shows no sign of breathing, coughing, or movement, begin CPR right away.
In all of these emergency situations, the #1 rule is to keep yourself safe. Remain calm, and in most cases, call 911. You don't have to be a paramedic or an expert to help save someone's life.
This has been a very brief overview of first aid techniques. We encourage you to learn more, and perhaps take a first aid course. There's a good chance you may need it someday.
Stay safe, and thanks for watching.